Dementia, signs and symptoms. Dementia is a crippling ailment associated with decreased comprehension and obstructed ability to function independently. Signs can vary from flawed judgment, memory loss, partial loss of language, and patients with dementia can have states of delirium and confusion. They do become hostile, and these symptoms progress over time. Causes. Dementia has several different subtypes. The most common subtype is Alzheimer's. Between 50 and 75% of patients with Alzheimer's eventually develop dementia. The second most prominent one being vascular dementia, which is about 20% of cases, and that is just dementia that is brought on originally by multiple strokes. Following that, there are Lewy body dementia and then also frontotemporal lobar dementia, which each take up 5% of cases. There are also less common causes as well. Diagnostics testings. Symptoms of dementia can also be explained by other diagnoses. So dementia diagnosis would most definitely consist of thorough medical history checks for the patient as well as the patient's family. It would also consist of a look into the patient's current or past alcohol or drug abuse, as well as the patient's current living conditions. This would be followed by both a mental and physical examination for the patient, followed by blood testing, a CT or MRI if necessary, a EGG, and then all of these results are then compared to a scale. There are multiple of these scales. Just one, for example, is the Montreal Cognitive Assessment Scale. And once they compare the results to this scale, they then decide if the patient has all the requirements for a dementia diagnosis. Treatment. A geriatrician is an MD who focuses on conditions brought on by old age. So a geriatrician would be considered a specialist in this disease. Also, a patient could see something like a speech therapist or an occupational therapist as well. Keeping up with daily activities such as reading, doing puzzles, jogging, all these type of activities like this, they decrease the decline in brain function. There are also pharmaceutical approaches as well that can help with the related symptoms of dementia. A diet at home for a dementia patient should be a brain healthy diet. It would consist of some things like walnuts, green leafy vegetables, berries, fatty fish, and a patient could also add coffee or tea to their diet as well. Besides this, a patient with dementia would definitely want to avoid saturated fats in animal. A Mediterranean diet is suggested as well. Prognosis. Dementia is a primary cause for death globally. Mortality increases of mortality have come along with factors such as old age, the male sex, patients who weren't previously diagnosed with Alzheimer's first, and then as well as dementia patients who are living alone. Patients diagnosed with dementia would have a life expectancy of about 3 years, according to some studies.